Today, the task force has deliberated carefully and decided to raise the risk assessment to DORSCON Orange. We have earlier confirmed a case of novel coronavirus infection on 5th February. This is case 29. Our investigations over these 2 days have not been able to establish a link to previous cases or any travel history to mainland China. Today, as of 2 p.m., we have confirmed 3 more cases, and while investigations and contact tracing of these cases are ongoing, there are as yet no links to previous cases or travel history to China. Globally, we have also seen an escalation of the situation. Hong Kong, Japan, South Korea had previously reported cases of unlinked local transmission. We have been preparing for this scenario, and we are ready to manage the situation. The key is quick detection and limiting further spread. Several of the locally transmitted cases were detected through our hospital's enhanced surveillance, despite the fact that they had no travel history to China. As our hospitals continue to remain on high alert, we expect to see more such cases emerge. As a response to these local cases without any apparent links to previous cases or travel history to China, we have stepped up our risk assessment from DORSCON Yellow to DORSCON Orange. Since last month, the government has implemented a series of defensive measures to reduce the risk of imported cases and community transmission, and we have progressively strengthened these measures as the situation evolved. These include border controls to reduce the risk of importation of cases, detection and isolation of cases and close contact tracing, active case finding for similar cases, enhanced personal hygiene and environmental cleaning, and heightened measures for vulnerable groups such as children and the elderly. With the transition to DORSCON from DORSCON Yellow to Orange, we will put in place additional precautionary measures, and Minister Lawrence Wong will share more later. We are closely monitoring the situation, and we will further ramp up measures if necessary. I understand that Singaporeans are anxious, concerned, and there is much that we do not yet know about the virus. New information is emerging daily. We expect that this is likely to take time to resolve, maybe months. Life cannot come to a standstill, but we should take all the necessary precautions and carry on with life. We will do our best to contain the situation and keep Singaporeans safe. At the individual level, we should protect ourselves by washing our hands regularly with soap and water and avoiding touching our face. As a general good practice during this period particularly, instead of a handshake, try alternative ways of greeting one another. Let us unite together to keep one another safe and do what we can to contain the spread of the virus together. Let me now say a few words in Mandarin. 政府跨部门工作小组在经过仔细的考虑后，决定今天把疾病爆发应对系统 DORSCON 的应对级别调高到橙色级别。我们在2月5日确诊有一位感染新型冠状病毒的，那就是第29起的病例。我们过去2天展开的调查结果显示，这起病例与之前的病例、其他的病例没有关联，也不曾在近期到过中国。到了今天下午2点为止，我们也确诊了另外3起病例。我们已经针对这些病例展开调查，包括追踪调查。虽然过程还在进行当中，但是到目前为止，这些病例都与其他的病例没有关联，近期也不曾到过中国。全球的局势也正在升温，香港、日本和韩国也出现了没有关联的本土感染病例。我们之前已经开始准备好可能出现的这类的情况，我们也做好了准备去应对。关键是要快速的确定这些病例，限制病毒进一步的扩散。本地医院在加强检测之后，发现有几起近期没有到过中国，而是在本地感染的病例。接着下来，我们的医院会继续保持高度的警惕， 因此我们预料会有更多的这类病例确诊。为了反映本地出现一些与其他病例没有明显关联，也不曾在近期到过中国的病例，我们已经决定把疾病爆发应对系统的应对级别从之前的黄色调高到橙色。从3个月起，政府已经推行了一系列的防卫措施，降低病毒入境以及病毒在社区传播的风险。随着局势的演变，我们也会逐步加强这些措施。我了解到，国人会对现在的情况感到担忧。我们对这个病毒的了解还是非常的有限，与病毒相关的新资料也不断的涌现。我们在预计我们预计疫情可能会相继一段的时间，可能会要好几个月。我们不能够因此生活就停顿下来，但我们可以采取所有必要的防范措施，我们继续活下去。我们将竭尽所能地控制疫情，来保障国人的安全。个人方面，我们应该经常用肥皂和清水来洗手，也要避免触摸自己的脸。在这段期间，我们也可以考虑用握手以外的其他方式来向其他人来问好，让我们能够团结一致，保障彼此的安全，并且竭尽所能，一起来控制病情的传播。谢谢大家。接着下来呢，我想请我的这个卫生总监 I'd like to invite my medical director, Dr. Professor Kenneth Mark, to share with us the status of the disease, latest knowledge about the virus, as well as some of the information. So I ask Kenneth to share with us on the coronavirus.
Thank you very much, Minister. I'll start off first by sharing a bit about the patients that we have who are confirmed cases and being treated in our hospitals. So in all, we've reported to you 33 cases of confirmed 2019 novel coronavirus infection, of which 17 were imported cases with a travel history from Hubei province. We've had 4 additional cases who are in fact passengers evacuated from a flight from Wuhan City. They are, and we have 7 cases have been reported previously, all linked to a cluster that was related to exposure to a travel group that come from China. 1 additional case that was linked to a business meeting organized in Singapore, for which other health jurisdictions have also reported infected cases in relation to the same meeting, and that includes 2 cases in South Korea, 1 case in Malaysia, and my understanding is very recently the UK have also announced 1 case related to the same meeting. And 4 cases have been reported now, where we continue to look for a link with either previous cases or relevant travel history, but our contact tracing to date has not demonstrated any such link. And that's the total of 33 cases. We have 2 patients currently in the ICU, and both of them require support to help them with their breathing. 1 patient is in the high dependency unit, and several, in fact, continue to require some level of oxygen support to help them with their breathing because of the pneumonia. 2 patients have been discharged. That includes 1 that was previously reported and 1 today. The global situation continues to show an increasing rise in the number of patients that we have. We have reports as of today of at least over 31,000 patients globally, with at least 320 patients also being reported outside mainland China itself. The global fatality rate has been reported based on these figures as 2%, and that the mortality rate, particularly outside Hubei province, is in 0.21%. The fatality rate within Hubei province is 2.8%. We continue to work towards understanding the nature of this disease, and the events continue to evolve. International experts, both in and outside China, have been working hard with us to try and identify better the transmission patterns for this disease. All of us still recognize that the main form of spread remains by droplets, and therefore it is very important, therefore, for us to recognize that most spread can actually occur through touching contaminated surfaces where droplets previously have been shed onto, and then subsequently with contaminated hands, touching your face, touching your mouth, your nose, and your eyes. There have been some reports of spread in patients from people who had at that time had not had any symptoms. The evidence to date suggests that that rate of transmission is in fact very low, but nonetheless, the mode of transmission is likely to be by droplets and again by touch. Because of this, we believe that the current precautions we've instituted remain sensible and appropriate based on our understanding of this method of spread. And that includes continuing to be meticulous and disciplined in our hand washing. Regular hand washing with soap and water remains the most important defense that we can have. Avoiding crowded places is a reasonable thing to do. And if you're sick, to continue to wear a mask to prevent spread of your own secretions, your droplets as you cough and sneeze from spreading to other people, and then to see a doctor as soon as you can. These precautions will continue to be the relevant precautions to take as we move on into DORSCON Orange. Thank you.
I'll now invite Wei Li from Ministry of Education to share what are the plans for our schools.
Good afternoon. With the move to DORSCON Orange, MOE will implement 2 more measures for school-going children because we consider them a vulnerable group. First, we will further enhance our social distancing measures across all our schools. We will suspend inter-school activities and external activities until the end of the March holidays, and then we will do a review. This would include the National School Games and learning journeys. The aim is to reduce intermingling among students across schools and to reduce our students' prolonged exposure to crowds to mitigate the risk of transmission. Second, we will be instituting personal and social hygiene protocols in our schools. For example, in our primary schools, our teachers will take our students to the restroom to wash their hands with soap and water before they go for recess, before their snack break, before their lunch break. In secondary schools, the teachers will remind them to do so. In fact, next week, even as we commemorate Total Defense Day, we will be instituting a protocol for our students to clean up the eating surface after they've had their meal in the canteen, in consideration of the person who might be coming after them. This is on top of the current measures that schools have been putting in place. This is the last week, just this week we had announced the visitor management measures, also the social distancing measures through suspension of mass assemblies, staggered recesses, and CCAs being organized in smaller groups. One of our teachers in Victoria Junior College has just been tested positive for the 2019 novel coronavirus. The teacher had not been in school this entire week as she was on medical leave due to a fever. So her last day in school was 31st of January. The college will take additional measures to safeguard the students and the staff. A few colleagues and students that have been in close contact with the teacher will be given 14 days of leave of absence since the last day of contact. The college will be also thoroughly disinfecting the staff room, the pantry, and the teaching rooms that the teacher was in. And CCAs will be suspended for 14 days for the college. And there will be smaller group sizes for teaching. So, for instance, in the lecture theatre, they will be seated in alternate seating. We will take similar measures for other schools if it happens to have cases in the other schools moving ahead. In this way, we can continue on with meaningful learning even as we keep our students and our staff safe.
Thank you. Now, maybe Lawrence can elaborate on the various measures that we are planning to introduce.
Good afternoon. As all of you have heard, so far, the cases of the coronavirus that we've had in Singapore have been mostly imported cases as well as a few locally transmitted ones. And we have been able to ring fence and isolate each time something happens. The new development now is that we have a case without any links to the previous cases or any recent travel history to China. And in fact, we have been preparing for such an eventuality, and that's why we've already strengthened our measures over the last few days. But today, given the latest developments, and with the step up to DORSCON Orange, we will now step up further precautionary measures. First, we will advise all event organizers to cancel or defer non-essential large-scale events. And for those who wish to proceed, we would want them to take all necessary precautions, and that would include carrying out of temperature screening, turning away of unwell individuals, and making sure that the event venues are adequately ventilated and equipped with facilities for hand washing. We have a series of precautions that we would want all event organizers to take should they wish to continue with their events. Second, all employers and individuals should implement regular temperature taking. This should be done at least twice daily, and organizations can decide on different ways of doing it. It doesn't have to be done at the individual level. And at office, you can do it at the entrance to the office so that whenever the employees come in, they take a temperature, and when they depart from the office, they take the temperature again. And then anyone with a fever or anyone who is unwell should see a doctor as soon as possible and avoid crowded places as they approach or as they make their way to see the doctor. Third, all workplaces should step up their business continuity plans. Right. Many have already done so. Many already have put in place these plans. We would like all workplaces to ensure that their plans are in place and step them up. And that would include taking measures like telecommuting or having split teams organized and operating separately. Right. These are important measures to also help to reduce the risk of transmission, of widespread community transmission. So these are 3 additional precautionary measures that we are taking today. In addition, for the vulnerable groups, we have another 3 more measures. At the hospital level, MOH will be implementing temperature screening and closer controls of entry points to hospitals. And our hospitals will also introduce measures to care for patients with pneumonia separately from other patients to reduce the risk of transmission. For schools, we have heard from the Director of Schools just now how they will be suspending all inter-school activities and external activities. And finally, for preschools and social elder care services, we will impose tighter controls on visitors to these premises. Overall, we are still working hard and doing our very best to prevent broader community spread of the virus in Singapore. So that remains our strategy today, but we have to be prepared for the situation to evolve in different ways. One scenario could well be that despite our very best efforts to contain, ring fence and isolate each case that comes up, despite our best efforts at doing so, there is wider community spread. And if so, as we have done already, we will have to reassess the situation if the situation worsens, and we may well have to take more stringent measures beyond what we are announcing today. There is another scenario which, in a way, the Director of Medical Services alluded to, because if you look at the situation now, the mortality rate in China is 2%, but outside of Hubei province, the mortality rate for this virus is 0.2%. It is much lower than SARS. And if the mortality rate remains low or even continues to fall further, depending on the evidence and depending on how it evolves, then I think we are dealing with something quite different, and we may well have to consider a different approach. So these are two scenarios of how the situation may unfold. It's too early to tell right now what the strategy will be, but I'm just sharing possibilities of how things may unfold in the future. Meanwhile, for now, I think all of us will have to do our part to stay vigilant, to keep our guards up and carry on with our lives. And Minister Gan earlier already shared some practical things that all of us, every Singaporean can do to protect ourselves and our families. And I would summarize it in 3 simple steps. First, wash our hands with soap regularly. We can't say this enough, right? We keep emphasizing this. Wash our hands with soap regularly, every day, more than once, as many times as you can. Number 2, avoid shaking hands. So we are, advocating everyone, just do a different form of greeting, whatever suits you, but avoid shaking hands. And don't use your hands to touch your face, because all the medical evidence shows that the transmission happens a lot through hands. Right, so that's the second thing we can all do. And thirdly, all of us can take our temperatures daily, twice a day, in fact, as we have suggested just now as an advisory to all employers and individuals. And then if any symptoms show up, if there is any sign of a fever, immediately go and see a doctor. So these are 3 practical, but we believe, based on the medical evidence, effective ways that all of us, all Singaporeans can take to protect ourselves and our families. Now, we know that these are challenging times. Singaporeans are anxious and worried. We understand these concerns, and we are doing our very best to put in place effective measures to protect ourselves, to protect every Singaporean. And I am confident that if we continue to stand together, if we continue to look out for one another, we can overcome this challenging situation together.
Thank you. Questions? The lady, yeah.
Hi, thank you. Aradhana from Reuters News. The first question is on this British citizen whom Prof. Mark also alluded to. There have been reports that a British citizen contracted this virus while traveling to Singapore, and that he may have attended the meeting at the Grand Hyatt. Just wondered if you can confirm that. And also, we've seen some media reports that mention that this event was organized by a company called Servomex. Would it be possible to confirm that? And my last question is on the air show again. On the back of the new precautions and asking companies to cancel large-scale events, just wondered if the air show will go ahead as planned.
I'll ask Professor Kenneth Mark to talk about the case with the UK case, and maybe Lawrence will also elaborate on the air show.
Yes, we in fact have been looking at this particular case quite closely. Our UK colleagues, in fact, have informed us that this case in the UK is linked to the same cluster that we had described earlier in relation to this business meeting. The details concerning the name of the company and so on, I'm currently not at liberty to mention, not because mainly because the matter is still under investigation at this point in time. It's also linked to the cases that have been reported in Malaysia and in South Korea.
On large-scale events, we're talking, when we say large-scale events, events that are in the thousands, right? And our advisory, just to be very clear, is for event organizers to cancel or defer the non-essential ones. But if they wish to proceed, and they can, then take all necessary precautions. So for the air show itself, I believe they intend to proceed. They will be taking all the precautions that we have highlighted. In addition, I believe they are looking at limiting the number of public visitors as well. Right, so that is something that the organizers will eventually put out, those details. But for the time being, for right now, as of now, I believe they are planning to continue with all these extra measures.
Perhaps I can just add that for specific events like air show, you probably can get in touch with the organizer. It may be better for them to explain to you what they intend to do. But from the task force point of view, the recommendation is if you want to proceed with large-scale events, then you should put in place appropriate precautionary measures. And we are in discussion with some of the organizers of these events to advise them what are the measures they need to put in place. And at the appropriate time, these organizers will make the necessary announcement, because we are just changing from yellow to orange today, and therefore they will need time to work out some of the details.
Hi, Timothy from the Straits Times. So previously you had said, there is no need for people who are well to start wearing masks because there's no evidence of community spread. Does this change now that there is evidence of community spread? And in the DORSCON orange measures, you mentioned that people should now start to comply with control measures. Could you confirm what this means? Because previously we assumed that people were complying with control measures. Thank you.
I'll ask Kenneth to talk about guidance behind the mask. I think it is still the same recommendation. So those who are well don't need to wear a mask. Those who are ill, we ought to wear a mask. And therefore, we are reminding Singaporeans, and now with community cases, transmission cases, it is important for those who are unwell to wear a mask and to seek treatment as soon as possible. But I think Kenneth can elaborate.
Yeah, Minister is correct. We believe that the main mode of transmission still remains droplets that come from an infected person to one who is not. The main way that they actually transmit is, in fact, through contamination of services. And therefore, if you're touching contaminated services and then subconsciously often, then touching your mouth, your nose, your eyes, transmission occurs. This form of transmission is best combated and defended against by regular hand washing, and with those who are ill, then wearing a mask to protect others, seeing a doctor as early as is possible, and avoiding going into crowded places. But for the general public, our recommendation still remains the same. There's in fact no routine requirement for them to wear a mask.
Compliance with which measure? Sorry, what specific measure are you referring to that? Yeah, I think we will work with various stakeholders, various organizations, for companies, for example, workers, for example, Ministry of Manpower, Ministry of Trade Industry will be engaging them. Our tripartite partners will be discussing with them how to introduce these measures. I think what is important is for all the stakeholders to realize that this is actually for their own protection. This includes business continuity plans. Some companies may decide to segregate their workers into different teams. Some may introduce temperature taking, as we have recommended, twice a day, even more often than that if they wish to. So some of these we are in discussion with them, and we are quite confident that they will comply, because it is in their interest to make sure that they protect their own business continuity and their own employees.
In previous media conferences, we had also explained that the DORSCON reflects our assessment of the risk of transmission in our community, but the type of measures we take would be based on a very careful assessment of what we think the situation is like, and therefore we put together appropriate and sensible measures that we think are relevant for the situation at hand. Notwithstanding the fact that we have changed our DORSCON level today, in our assessment, and we looked back at the suite of measures that we have in fact steadily put in place, we believe that the measures we currently already have in place remain robust and remain appropriate for the setting and the situation that we now find ourselves in. There are some additional measures that we feel can be further tweaked, and these relate to sector-specific precautions that we think we could strengthen. But by and large, the general set of measures that we in fact had previously announced, they remain appropriate, sensible, and they remain the main defense precautions that we have now.
Just say very quickly, this issue of compliance with different control measures, it goes back to something we have said from the very start, that whatever we do today or in dealing with this virus cannot rely on the government alone. There are multiple lines of defense, and one very important line of defense is that community organizations, employers, individuals have to step forward and take responsibility for these measures. So we have put out advisories. Where necessary, we will enforce. If we can, where we can, we will regulate and enforce. But many of them are advisories, and we hope and we are confident that employers, individuals will be responsible to comply with these advisories. And if all of us do that, we can then overcome the situation.
Thank you. The lady at the back.
Cheryl from CNA. So raising the DORSCON level obviously means the local situation is more serious now. How should the public react to this change? And will we come to a point where we will stop contact tracing entirely, given that establishing the link of infection is no longer significant? And going back to the DORSCON, will there come a point where we can actually lower it back to yellow?
Thank you. I think I would say that the current situation, when we raise it from yellow to orange, is primarily because there are now cases that we are unable to determine the source of the infection. They are not linked to any existing cases, nor linked to a travel history to China. And therefore, we suspect that there will be sources of the infection that is in the community, and therefore we are raising the alert level to DORSCON orange. Many of the measures in DORSCON orange, as Kenneth has mentioned, in fact has already been in place, and we are stepping them up. And there will also be opportunity in time to come for us to consider stepping it back to whether it's yellow or green eventually. And this will depend on how the situation evolves. Let's say, for example, if we are able to contain the cases and we are able to determine for the cases that we know already are able to determine the sources of this infection, and those which we could not determine have recovered and discharged and no longer infectious, then we will then consider stepping back from orange to yellow, because it's back to where we were yesterday, where we are able to determine all the sources of the infection. So I think there are multiple factors, and even the DORSCON framework has several factors that we need to consider. At the end of the day, the professionals will have to make a judgment whether we are at a state of yellow or orange, and then we will decide whether we will change the DORSCON level when the time comes. But I think it's, at this stage, it's too early to talk about stepping back, because we are focusing now on ensuring that the various stakeholders are aware of the change in the DORSCON level to orange and what are the measures they need to put in place, and we will help them and guide them along so that they're able to comply with the requirements.
Hi, this is Maya from NNA. In our workplace, as you mentioned, temperature should be taken twice a day. But what's the temperature that people should not go to work?
Sorry?
What's the temperature? What the
Cut-off temperature.
Yeah.
What's the cut-off temperature?
Trigger temperature.
Trigger temperature.
Yeah. So our schools in particular have been having very regular drills where students and teachers would be monitoring their temperature, and various workplaces, I understand similar exercises have been done before. So the process of temperature taking is not something that would be alien. It would be quite familiar to many people in the workplace and in the schools. Customarily would recognize a temperature of more than 38 degrees Celsius or 38 degrees centigrade as a fever. And certainly anyone who's found to have a high temperature, we would recommend that they should not then be close to other colleagues or students, and they should see a doctor as soon as possible.
Maybe the lady in front.
Hi, Cassandra from Yahoo News Singapore. Will you be able to provide more details on the other case who has been discharged, and as well as details on who are the two cases that are in critical condition? And the third question would be, would the grant hired case be considered a separate second local cluster?
Just give me a moment, try and get you some information.
Maybe,
So,
yeah, go ahead.
I understand the second patient that, in fact, is to be discharged today is case number 2. Previously, in our press releases, we in fact had given you some information about that patient already.
So we have a discharge 1. We are discharging a second one
today.
today.
Yes.
So I think if you need the patient details, what we can do is we can provide you with some of the background of the patients, but there's a limited information we can share because of patient confidentiality. So where we can, we will try to put in the press release for you so that you have sufficient details to report. You wanted to clarify something? Okay. Sorry, I think you wanted to clarify something just now?
The high fever is what's the temperature?
Yes, so as I mentioned earlier, if you are monitoring your temperature and you have a temperature above 38 degrees centigrade, we recommend that you should not continue in the workplace or in school. You should go and see a doctor.
Okay.
Thank you.
The lady in front? Or details of the ICU patient?
There are 2 patients currently in the ICU, and both actually require support to help them with their breathing because of their lung infection or pneumonia. Unfortunately, to preserve patient confidentiality, we will not be able to give you specific information about who they are.
Maybe the lady in front? Yes.
Hi, Shahinda from Mothership. I just want to ask if this is the first time Singapore has reached DORSCON Orange, and if not, when was the last time? My second question is, I understand that we are coordinating with the World Health Organization. How are we doing so? What are the details that we are giving them?
Okay, to answer the first question, in fact, this is not the first time in which we've actually changed our DORSCON level and reached DORSCON Orange. That first time on a previous occasion, in relation to the H1N1 influenza outbreak that actually occurred in many countries in the world, we had done the same as well. And as we had a better understanding of that illness and realized that, in fact, its behavior was very similar to what other forms of influenza was, it provided us with an opportunity, therefore, to reassess the risks associated with this infection to our population and then lower our DORSCON accordingly and eventually back to normal. So that's, in fact, one example where we did go up to DORSCON Orange, and also an example where we had an opportunity then to bring that back to normal. We continue to work with the WHO, as all our countries do. We are part of an international framework working under what we call the International Health Regulations. It's overseen by the World Health Organization. And part of our responsibility as members of the World Health Organization, in fact, is to participate and cooperate in sharing information about the cases that we have, the treatments that we give, and in contact tracing. And in particular, with regard to contact tracing, we have, in fact, shared information to allow other jurisdictions, other countries to also then do relevant contact tracing for travelers that have gone to their countries. And and similarly, they've asked us for information about, and asked for cooperation to track visitors to Singapore, which are of concern because of this outbreak as well. And we have done our part to cooperate and partner the World Health Organization and other countries in this regard.
The H1N1 experience is also probably a good example of to reply to Cheryl's question about how we downgrade from orange to yellow and to green. So we did go to orange in H1N1, and then subsequently we downgraded it to yellow and then back to green. So if you look at the history, you probably have a sense of how it can be escalated and can be de-escalated as well.
Thank you. I'm Felice Solomon with the Wall Street Journal. Have you identified the source of the infections linked to the conference at the Grand Hyatt, the sort of patient zero of that conference, as you will, and how many countries are involved in the investigation into attendees of that conference?
We have not as yet identified the actual source for infection. The foreign participants of that meeting have all left Singapore, and because of that, we have passed their particulars to our counterpart health authorities in the relevant countries for them then to do further contact tracing, to then check on their well-being and their health status. They have yet to inform us on the results of their own investigation, and therefore we will not at this stage be able to tell you about the status of all the participants that attended that particular meeting. Those investigations still continue. I don't have that information with me right now. Yeah.
We can probably check. If we can share, we can let you know. Just to put it in context, you would understand that many of the investigation actually needs to be carried out in other countries because the patients have already, or the participants have already gone back to the respective countries. So there's very limited what we can do here. We are carrying on with our investigation and contact tracing of those Singaporeans who are still here, but for those who have returned, and some of the investigation has to be done where they are now. So I think it's something that we are working with the foreign authorities, share information so that they know how to proceed in their own contact tracing and history taking to find out where these their participants have been to, who they have been in contact with. A bit similar to what we do here, but we will not be able to do that part of the work for participants who are already in their home country.
Yeah, hi. So I have two questions. So one is that with more confirmed cases now, we have no travel history and no contact with known cases. What advice will be given to doctors and public to catch these cases and accurately categorize them as suspect cases? So my second question is, suspect cases have increased sharply over the past 2 or 3 days. Has the definition of suspect cases been expanded? Yeah.
Well, I'll say something and then ask Kenneth to add on. I think one of the reasons why the suspect cases number have gone up, and in fact they were now unlinked cases, is because we have actually expanded the case definition, and we are now doing what we call proactive case finding. That means we are telling our hospitals, our clinics that never mind whether they have a connection to China, when you have a pneumonia, I want to know whether it is this particular novel coronavirus. So in the past, we always have a case definition. We do risk management. We define if you have contacts with China or with exposed regions. If you come from exposed region, then we investigate further because there are many pneumonia cases in Singapore normally. But now we have expanded the definition, and we are now therefore investigating into more cases, and as a result, we discovered more cases. And that is actually one way for us to detect cases where they have seemingly no connection. And that's how we have also have these cases that with no links being surfaced. So I think to answer your question, yes, and because we have now gone on to this enhanced surveillance system, we are able to detect cases that have no connection with China or with any previous infection cases. And this is an important step that we have taken to enhance our surveillance. Kenneth, can add on?
Yes. We continue to review our case definitions carefully, but at this stage, as we move from DORSCON yellow to orange, we've not actually made a change in that case definition. We still believe that it's relevant for our doctors to look for a travel history simply because the majority of our patients that have presented with this infection in our hospitals still have an association with a travel history or exposure to a traveler from China. So that concern still remains. That's still part of our case definition. But what we've done is also to encourage our doctors, particularly those who are dealing with patients with pneumonia, to have a higher index of suspicion. And as Minister has alluded to, we've in fact commenced a process of active case finding. That implies even without a history of travel to China or any other country, in fact, where where this infection is present, if they have any patient who has pneumonia, we in fact have started to also test these patients just to be on the safe side. Patients also who are admitted in the ICU, we've also been keeping a very closer watch on them and also testing them as well. So the patients that we have that have been picked up, were picked up as most recently were picked up as a result of this enhanced surveillance. As I mentioned earlier, we survey patients who, in fact, who have pneumonia, and the majority of patients who present this way. But we've had a few patients who presented at the time when they were tested positive, in fact, didn't have much of symptoms, and that includes at least 2 of the patients, if you remember, we presented earlier, who, in fact, were part of the flight that had evacuated from Wuhan. We continue to look at the patients that come to us. With each patient, where we make a diagnosis, we interview them and talk to them, and more information comes on. But for the latest series of cases that we reported today, that contact tracing and investigation still continues. So it may very well be that over the next few days, we have further information for you. I'm aware that at least 2 of them have. I'm unable to give you information about the remaining patient.
We have time for 3 final questions.
Gentleman in the middle. And then maybe one more, the lady here.
Hi, thank you. Phil Hymas from Bloomberg. I just wanted to maybe rephrase Felice's question. In addition to Korea, UK, and the third one, Malaysia, have you contacted any other countries with regards to the Hyatt case? Also, even though you're not saying the name of the company just now, can you at least give us more details about what that company is now doing? Have they taken further precautions that we should be made aware of? And finally, has Singapore ever been to red before? Thank you.
I think Kenneth can talk about the cases, whether we have been in touch with the authorities in these 3 countries. Or beyond these countries.
The answer is yes. I can't give you the full list, but I think previously we had also mentioned that there were participants in the business meeting that, in fact, had come from China as well. So that information is common knowledge. We have contacted the health authorities for all the countries where these participants have returned to, and they continue the investigations on their end.
Beyond China as well?
I don't have information about what other countries involved, but the countries that we've mentioned already, plus countries mentioned today, this is, in fact, have been announced previously as well.
As far as I know, we have not gone red before.
No. You asked about the company involved. The company, in fact, has been very cooperative, and that's how we've also managed to get a list of the participants and allow us then to start off the process of contact tracing and inform our sister health authorities. The hotel where this business meeting took place, in fact, have also done their part. They've stepped up and performed a deep cleaning of the facilities where the business meeting had taken place. And they've done that in order to provide the assurance that the hotel remains a safe place for their guests and for visitors.
Thank you. Maybe the last question, the lady in front.
Hi, Zhao from CNA Digital. I just want to ask, since Thaipusam is happening, are there? I know you've already given like large, precautions to take already, but will there be any additional measures given that it's really a very large-scale event? And also for the ICU patients, do they have any comorbidities, even if you can't give us any other details? And how old are they? And also, for the patients who have been discharged, are they still in Singapore or have they gone to Wuhan if they're from there? Yeah, those are my questions. Thank you.
I'll ask Minister Lawrence Wong to talk about Thaipusam. And on the patients, we'll try to give as much as we can, but there's a bit of a patient confidentiality, especially as to where about he is now. I think we will not be able to tell you. But I think some of the principle behind the underlying condition and so on, I think Kenneth can share the basic disease progression pattern.
For Thaipusam, the answer is, it's the same thing as was asked about the air show. For all of these events, we have communicated our advisory to the event organizers. For Thaipusam, of course, it's very short notice. It's just happening tomorrow. But my understanding as of now is that it will continue and they will take the necessary precautions, including temperature screening at the start and the end, right, of where typically you have more people coming. So again, I would, as we have said just now, each event organizer will taking into account the advisory, will take all these precautions and new measures, and they will highlight this to all the participants of their own events, and they will make public these new measures as well, that they are, for each event, the measures that they are taking, if they so wish to continue.
With regard to the two patients who are currently in the ICUs, both do not have any significant other medical problems. I'm unable to give you the ages because I know we've given you ages and told you about the case numbers, and by telling you the ages, in fact, it's a form of identifying these patients. So unfortunately, in order to protect their confidentiality, we'll not be able to give you that information.